Welcome to the Intensive Care Unit, Coast General Hospital, Mombasa County, 001. My name is Dr. Yakub Sheikh. I'm a clinical pharmacist specialist in critical care. This is one of the largest ICU referral facility in the region, in the entire Coast region. We have 12 bed capacity and 4 pediatric units for the children. So my role here as the clinical pharmacist in ICU basically is to advise the medical team in terms of the medicines we use here. Remember, the medicines we use in the critical care department are not the same as the ones which we use in the ward. So the medicines we use here basically are highly potent medicines. Some of these medicines are high alert and they have a high potential of error. So we need close monitoring of patients in this unit. Ward rounds are multiple times a day, and we keep monitoring these patients closely. So in terms of medication therapy management, we try our best to look at how the medicines are performing in our patients, how the patient is responding to the treatment. And there are several parameters we use other than just the lab investigations. We use the vital monitor, and we use pulse oximeters and so on and so forth. The medicines, remember here, the patients cannot take their medicines through the oral route, so most of the patients here are either on IV medication, or some of these medicines have to be crushed and be given through the nasogastric tube. So my role is to advise the medical team in case if the patients, if there are no oral IV formulation of medicines, I advise them on the oral formulations, and if those particular medicines need to be crushed, I also advise them as well. Because remember, when you crush the medicines, the pharmacokinetic parameters, you're altering the pharmacokinetic parameters of that medicine, especially if that particular medicine is a slow release medicine, it's an extended release, if it's a controlled release, and so on and so forth. So the other point is we usually also we do what we call antibiotic stewardship, and in terms of my role in the antibiotic stewardship is to make sure we are treating the correct bug with the correct drug, and we usually review the culture results together with the medical team, and I advise them on the appropriate antibiotic of choice to use. And where there are cases which we need to de-escalate on antibiotics, I advise them as well. Remember also, these patients are critically ill, and some of them come in with renal failure, acute kidney injury, some with chronic renal failure. So these medicines need to be dose adjusted as well. So we usually calculate, we do the necessary calculations for the creatinine clearance, and we dose adjust accordingly. And the main aim here is to provide patient safety, at the same time make sure that patients are responding to their medicines. Remember, medicines at the same time can treat and they can harm you if not taken properly. Yeah. The other thing we also do here in the ward rounds is medicine reconciliation, and we make sure what the patient was receiving before is not being duplicated in the treatment as well. So we do medication history taking, and we usually sit down with the relatives and ask them, and we usually tell them to bring all the medicines the patient was using before admission, and we cross-check with what we are giving, so that we make sure there are no potential drug interactions. And if there are patients who are going to be taken to surgery, we ensure these patients are not on any anticoagulants, and so on and so forth. In terms of pain management, pharmacist here is the key person in terms of making sure that patients are pain-free, and we advise on the different types of combination of analgesics to use in terms of patients who are having cardiac issues, who are having renal issues, and those who are having liver issues as well. So this is the role of the pharmacist in the intensive care unit.